Hello, everyone. I'm Deacon Pedro, and welcome back to our continued series during this time of pandemic, Faith in a Time of Crisis. Now, very quickly into the coronavirus crisis, I realized that news outlets were not covering the plight of refugees anywhere. Very quickly, we forgot about the people of Syria and the people of Venezuela. Very quickly, we forgot about the Rohingya refugees in Bangladesh. Yet, these people are not immune to the virus. In fact, they are more vulnerable to it. And in Bangladesh, in the wake of Cyclone Amphan, the crisis has intensified. To help us understand how the crisis in Bangladesh is unfolding, I am now joined by Dominique Godbout. She's the Humanitarian Program Officer at Development and Peace-Caritas, Canada. Dominique, welcome. Thank you for being with us.
Thank you for having me.
So for people that maybe do not remember the Rohingya refugee or were not familiar with that, can you remind us who are the Rohingya people?
Yes, the Rohingya are an ethnic minority that are Muslim. They're from Myanmar, or a country that we call also Burma. And they have been discriminated against for the past decades. They have been victims of waves of violence against them because they're not recognized as nationals. According to the Myanmar military, they are not national people. They come from Bangladesh, and so they should go back to Bangladesh. And so these waves of violence have occurred throughout the past decades, and most recently is the one that occurred in 2017, where more than 900,000 Rohingya people crossed the border from Rakhine State in Myanmar to settle in Bangladesh in the district of Cox's Bazar.
Right. So that would have been some of the images that people might remember from, as you said, 2-3 years ago, of people crossing through rivers and just to clarify, so you said that they are Muslim, but they're not considered citizens of Myanmar. Is it a religious thing? Is it because people in Myanmar, the majority is a Buddhist country?
I mean, it's a mix of those reasons. I mean, there are some other Muslims in the country that do have their own nationality.
Okay.
I think it's really due to their position where they are located in the country. That they say that those people cross from Bangladesh because they live at the border of Bangladesh. And they are a minority, but there's the numbers it's difficult to know exactly, but there are about 2 million Rohingyas. And so there's a lot of Rohingya left in Myanmar that are still living in very squalid conditions, which we are also worried about, and we have no humanitarian access to these people.
Right. I was going to ask you about that. So you said about 900,000 are in camps in Bangladesh, and so maybe about the same amount remain in Myanmar. Is that what you're saying? Yeah.
Yes. And let's not forget that there's also other ethnic minorities in Myanmar that are victims of violence, and that are at the north of Myanmar or located at the border of Thailand. And those Shan people, there's a lot of other ethnic minorities that suffer from discrimination because they are not recognized as nationals and don't have the Myanmar nationality.
Right. And not to take away the focus from that region, but since you mentioned that there are other refugees, would you say that the situation of refugees around the world is a similar one? That, I mean, because they're in camps I mean, there's a lot of internally displaced refugees that are not in camps, that the situation has intensified for them because they're not considered, nationals to any country?
Yes, I mean, it definitely is an underlying reason, and yes, it definitely it has similarities. Yeah.
Mm-hmm. So, like, I can think of the people in Syria. There was a time there where we all, in fact, after the Rohingya crisis, we all would hear every week news of people from the Middle East, mostly Syria, that are trying to move into Europe, but we don't even hear about that situation anymore. Do you have any updates on that, or the work that Caritas is doing in those regions?
Yeah, I mean, Development and Peace has had the long-term partners and programs in Syria and also in Jordan and Lebanon and in Turkey to help those Syrians who had to cross and flee their country because of the conflict. And we also have humanitarian programs in Colombia for the Venezuelan refugees. And yes, those situations are similar in the sense that they all had to leave everything that they had, their belongings and their loved ones, and had to flee, not because they want to. They all want to go back to their own country. There's no doubt about that. If you talk to the Rohingya or to the Syrians, they will all say the same: I want to go back to my country. But in a peaceful country, and in a prosperous country, and those things don't exist anymore. It will take decades before Syria can be built again, or if it can be, they can find a normal life. And you can tell that there's a sense of desperation there that they'll ever find a normal life again.
Mm-hmm. And for the Rohingya people, would they consider themselves Burmese, or that they belong in Myanmar, because they're not being accepted in Bangladesh either? Is that correct?
Yes, that is correct. Yes, they do consider themselves Burmese. They say that that's where they are from and they want to go back. I mean, we have to say, to commend the Bangladesh authorities that did welcome all these people, that in a very short moment of time, like in a few weeks, floods of people that crossed the border, and they welcomed them. And Bangladesh is a very poor country, and they have their own problems, yet they still open their arms and welcome them. Of course, they are welcoming them, but in refugee camps. So in situations where they're not allowed to get out of the camps, and they're not allowed to work, and until very recently were not allowed to have access to education. And so because they really want to keep the situation temporary, they want to make sure that these people will go back to Myanmar at some point.
Yeah. Just so that people understand the situation a little better, I don't know if you know, what is the population of Bangladesh? So if there's 900,000 refugees, how does that compare with the overall population of Bangladesh?
It's a good question. I don't know it by at the top of my head, but Bangladesh is a very popular, one of the most populous countries in the world. Okay. And so in a sense, it's not as if it happened in Canada, for example.
Right.
You know, the proportion, but it's just compared to their situation. They're already very vulnerable, and they don't have the health facilities or the economic backbone to offer the services that all those people need. Yeah. And just also the fact that these people don't speak the language, and there's all sorts of hurdles like that that they need to consider. And so that's why they keep saying that the situation is temporary, and they want to ensure that the refugees will go back to Myanmar.
Yeah, temporary. It's been 3 years. Now, you said that the Bangladeshi government did welcome the refugees. However, they're in camps. Are these camps run by the United Nations? Like, obviously, it's not the Bangladeshi government that's caring for the refugees in the camps. They rely on I guess, organizations like Caritas to...
Yes, it's a very good question. In fact, they are run by the Bangladesh authorities, in a sense that Bangladesh really keeps a tight control on the response, on the humanitarian response. And so the UN agencies are managing the camps, that's right. UNHCR and IOM are the two big agencies in the camps with which Caritas Bangladesh and ourselves work regularly with. But everything has to go through the Bangladesh authorities. The permits to have a project start, visas for staff, every single decision has to be run through the Bangladesh government. It slows down the process, but the Bangladesh authorities make sure that they keep control of the situation that way.
Right. Now, Dominique, you've been there.
Yes.
How does the situation compare to other refugee situations that you've seen?
I mean, I think what is the most striking thing is just how massive it is. I mean, it's a big city. It's an overcrowded city. I mean, of course, it's not. There's dirt roads, but it's not like nice roads. It's not a nice city, but it is. There's just a lot of people, a lot of shelters everywhere. And a lot of women and children. It's 80% women and children, so children are everywhere. And the sanitary conditions are terrible. But I do have to say that compared to the first time that I went more than 2 years ago, and the last time that I went 6 months ago, there's a huge difference. There's a huge difference in terms of access to water. And just the shelters. I mean, we're with Caritas Bangladesh, we're working really hard to rehabilitate and build strong shelters. And so there are definitely progress. But it's still a lot of people in a very congested area, and it's very hilly. And so it's very, there's a lot of risk because of if there's storms or cyclones, and if there's a lot of risks of landslides and of flooding, and so they are in a vulnerable situation.
Yeah, and we will talk about those dangers, especially to tropical storms in the region. So under normal circumstances, so before COVID-19, what is the kind of assistance or efforts that Caritas would be doing for the refugees in the region?
So we do, like I mentioned, we do training to the Rohingya people, and we provide them with materials, shelter materials, for them to rehabilitate their own shelter. They do want to work. They're not allowed to work, but to help them restore their dignity, and also to make sure that the shelters are actually adapted to their needs, especially to the women and girls' needs. Then we have to listen to them and to make sure that the shelter models that we build are appropriate. And so once we are sure of that, then we provide training and materials and rehabilitate the shelters and build new shelters. Right. And also the surrounding area of the shelter. We did at the beginning also provide food and rehabilitate water points or build water points. We distributed non-food items, which are soap and all sorts of those kinds of things. And also, we do have to mention that we help also the local community around the camps, because there's kind of a backlash to the humanitarian assistance that we do need to take into consideration, because it's serious, is that all the help is going into the refugee camps. And the local communities are growing resentful of the situation, and it's totally understandable. I mean, they need a safe shelter also, and they need access to water, which they don't necessarily have. And so the more help that is channeled to the refugee camps, the more the resentment is growing. And obviously, Caritas Bangladesh, being a local community-based organization, very attuned to the situation of the local people, raised the red flag, and now we are making sure that we are also helping the local communities that are around the refugee camps. And so we're working on, for example, small businesses for women, and just trying to raise their livelihoods a little bit.
Yeah. Okay. That makes perfect sense. Now that we're in this COVID-19 situation, do you know how the situation in general is in Bangladesh? Before we talk about the situation in the camps, do you know how the coronavirus crisis is affecting the whole country?
Yes, I do. I mean, so there was a general lockdown of the country that was declared on March 23rd, and they call it general holidays. And so this lockdown means is similar to every lockdown that, including the one that we have in Canada. So people have to work from home, and social distancing, and shops are closed. And there has been some transmission, quite a bit of transmission, in fact, but they have so much limited capacity in terms of testing that most people say that it's not representative of the actual situation. Like like I said, it's a populous country, and so social distancing is not possible in every case. And also, people have to think about their livelihoods if they're going to, and just surviving. And so, if they want to have access to food, then they'll go, and if that means meeting people, and they will do so. You know, they don't have the luxury of ordering their food at home, and so that's also a reality that they have to face.
Yeah, of course. I know we started off talking that no one is reporting on what's happening to refugees or in refugee camps, but really no one's really reporting what's happening in any poor country in general. So you mentioned earlier that you work with partners. There are, Caritas partners and United Nations partners on the ground. One of those partners, I guess a friend of yours, is Pinto William Gomes. He's a project director for the emergency response program for Caritas in Bangladesh. And he actually sent us a little video to kind of give us a little general idea of what the situation is in the camps right now, or how the COVID-19 is affecting the camps. So Dominique, why don't we listen to Pinto's video, and then we can talk a bit about it.
As on yesterday, a total of 13 COVID patients have been identified in Rohingya camps. We think that COVID-19 has very potential impacts on the lives of Rohingya people, those are living here. The people, those are living here, it is very densely populated. About 50,000 per square kilometer people are now living here. It is very difficult for these people to maintain the social distances among themselves because of these densely living conditions. On the other hand, the water, sanitation and hygiene practice of the Rohingya people are very poor. So it is also very difficult for themselves to prevent COVID at the community level transmission. The nutrition status of Rohingya people are not very much good. So it means that they have poor immune system. So it will be vulnerable for COVID impacted very soon. The health facilities as well as quarantine opportunities and isolation centers are created, but it is not sufficient. We think that if it is spread more, then it will be very difficult to save the lives of the Rohingya people. So all preparedness measures for spreading COVID at the Rohingya camps should be taken by everybody.
So that was Pinto William Gomez. He's the project director for the emergency response program for Caritas Bangladesh. Dominique, he mentioned, a lot of things that make perfect sense, but there's quite a lot of different things that are happening here. So, and you had mentioned this already, that it's a very densely populated area. So how is that intensifying, I guess, the challenge in terms of preventing these cases? He said there were 13, I believe he said 13 cases, but how quickly before those 13 become, 300?
Yeah, I mean, you're right that social distancing is not really possible. And so prevention is really still the key, in the sense that communicating with the communities and making sure that they have the right information and that they understand the situation. And so to make sure that they follow the guidelines. And so to wash their hands frequently, even though, it's obviously this is, but Caritas Bangladesh is providing water points and portable hand washing stations. Yes, and they are training volunteers to go, Rohingya volunteers to go door to door and to make sure that everybody understands the situation and what they have to do. And they are asking people to stay inside their shelter as much as possible.
That
But
must be
obviously, yes,
very.
with the heat, I mean, the heat in those shelters, it's quite. Nobody would be able to stay all day in that shelter, and so of course it could be very catastrophic, to be honest, if it actually spreads in the camp.
Yeah, I can't imagine. So I guess there's also a lot of education happening, teaching people about using hand sanitizer. I don't know if that's even available, but the water washing. Are they providing face masks? Is that something that's an option?
Yes, they are providing, or they are asking them to use their own kind of homemade masks and training them to do so. But yes, awareness messages are the key, especially to combat misinformation. There's a lot of information going on, and people have kind of these false ideas about the virus. For example, that if they catch them and they go to seek, if they catch it, and they go and seek medical help, that the medical people are going to kill them. And there was these ideas like that, and so they wanted to hide their symptoms and not go and get medical assistance. And so those are the things that we need to combat every day to make sure that they have the right information to try to combat the spread of the virus.
Right. Pinto mentioned something else that I had not thought about. He talked about how because their nutrition is not very good, their immune systems are very poor. I guess that means that we need to help feed them better. How difficult is that?
Yeah, I mean, they've been dependent on food assistance from the World Food Program since the beginning. And so from the UN agency is feeding them every day for the past years. And so that's the reality. And of course, it's limited what the agency can distribute to all these people. And so, yes, they have a weakened immune system. This means that unlike in Canada, for example, where we see that the people that catch it and that develop complications are over 7-year-olds, well, in fact, for these refugees, it will probably be anybody that can have complications due to the underlying health conditions that they have.
Interesting, because of and as simple as poor nutrition and clean water. You mentioned something earlier, and I think that people might even remember photos from previous years where there's been flooding. This region is very vulnerable to tropical storms, cyclones. There's one that just hit recently, Cyclone Amphan. How has that complicated the situation?
It has complicated the situation because evacuation is not an option in the refugee camp. And so, again, they have to stay inside their shelter or the community shelters that are in the camps. Such Caritas Bangladesh has 10 or 11 of them across the camps, are converted into cyclone shelters. But then that means that all these people come together in very close quarters, and that's not a good idea given COVID. And so it is complicated, but luckily the storm did not hit hard in the refugee camps. It did affect in India and in some coastal area of Bangladesh, but the refugee camp was not hit too strongly this time. But it is monsoon season starting. And it's definitely a concern for all humanitarian actors in the camps. And Caritas Bangladesh has emergency shelter stocks available, and so ready to distribute, shelter kits if shelters are damaged. Other actors are ready to distribute food, So if a cyclone hits, the humanitarian community will be there. But does it mean we'll have to start over from the beginning? That would just be a nightmare situation.
And it's so hard, and it's like, I guess, not to compare, because it's not comparable at all, but we think the coronavirus, it's so hard because we don't know when it's going to end. But think of the situation of these refugees. They don't know when their refugee situation is going to end. And some people, you know, it's not like they're going to be refugees for 3 years. They could be refugees for 20 years. Children might be born and grow old in a camp. And that's maybe what's different about the refugee situation nowadays. Thanks to organizations like Development and Peace and Caritas, things can be a little better. Dominique, how can people who are watching right now help Development and Peace and Caritas make a difference?
Well, for sure, a donation is always appreciated. I mean, there's so much to do. I mean, Caritas Bangladesh is a phenomenal partner to work with, and I'm very, very lucky to be working with such courageous people. But of course, also, if Canadians want to speak to their deputy about the situation or bring it to the attention of their local government, just so that it stays in Canadian diplomacy, to try to find a diplomatic solution. That's definitely something that would be very helpful, and also obviously to push for a solution with Myanmar. To again, the Rohingya want to go back to Myanmar, and so we need to find a solution to this deadlock at one point. And the Canadian government has been at the forefront of the diplomacy efforts around this conflict. And they have been also supporting our work in the camps, and we've received funding from Global Affairs Canada, and so we know that they believe in that this crisis is important for Canadians, but it's always a good idea to talk to your local government and put it in front. Remind them, exactly.
Yeah, of course. You mentioned donations, and of course, donations are always good. So people should go to the website devp.org, Development and Peace Caritas Canada. I'm sure there's lots of information there of all the work that Development and Peace is doing, not just in Bangladesh, but all over the world. So I encourage people to go and support them. And as Dominique said, also call your local government representative, your federal government representative, and let them know your concerns. And of course, prayer, right, Dominique? Prayer always helps, and especially during this time.
Yes, they will need it. They will need to feel our solidarity, like you mentioned. They are in a crisis situation as refugees, and then there's COVID, and then there's cyclones. I mean, it's a lot. And yeah, if they can feel our solidarity,
absolutely,
wonderful. Yeah,
absolutely. Thank you, Dominique, for bringing this to our attention. People are. It's very easy to focus inward, and I think part of what this crisis, this COVID-19 crisis, is helping us learn is that we need to look outward to care for each other. And in a way, the world is becoming a smaller place because of that, and I think that's good. So thank you for the work that you do, the work of Development and Peace Caritas, and for telling us about it today.
Thank you so much.
Yeah, Dominique Godbout, she's the Humanitarian Program Officer at Development and Peace Caritas Canada, and she joined us from her home in Montreal. And that's all for today. Thank you for being with us. Remember to continue visiting our website, saltandlighttv.org, for more articles and videos on the coronavirus pandemic. And most importantly, remember to continue finding faith during this time of crisis.